Achilles is probably one of the hardest ones because we have 3 or 4 Achilles-based diagnoses. So we have a classic mid-Achilles problem. We have an insertional Achilles tendinopathy. We have a plantaris-associated tendinopathy. And we have a peritendon-associated tendinopathy. So we actually have 4 tendon-based diagnoses, and you have to be clear about which one of those you actually have, because the insertion is more about a compressive load. The classic mid-Achilles is more about energy storage and release. The peritendon is more about a friction load, and the plantaris can be both compression and or friction. So can you see how important working out the load is to actually making your diagnosis? So that's just in the Achilles itself. Then you have a range of structures around the Achilles that can mimic Achilles pain. So we can have posterior ankle joint symptoms. We can have sural nerve symptoms. We can have superficial bursa that can create symptoms. We can have issues in and around our posterior retinaculum that can create issues. We can have a classic neurally mediated signs and symptoms. We can have our medial tendons, so our FHL and FDL, on the medial side, tib post. We can have perineal tendons on the outside. And people with their diagnosis, if you come back to localized pain that stays local with load, will often help you sort that out, because if they don't point to their Achilles, they point more to the inside or to the outside, you can sort of start to think maybe this isn't a classic Achilles. So there's a lot of things going on in and around the Achilles. The problem we have is you can have Achilles tendon that might be plantaris associated and might have a peritendon, plus you might have some neural signs. So you can have 2 or 3 sources of pain, and you have to deal with each of them. You can't just hit them with a tendinopathy program, because you might help the tendinopathy, but you might provoke some of the other conditions. So Achilles is quite a hard one.